starting with the introduction, like all of us know that tobacco is an agriculture.
Can you make it full screen, please?
I'm sorry?
Can you make it full screen?
Okay, let me try. Is it okay?
Yeah. Now it is good. Thank you.
Okay. I'm sorry, as you have changed my time slot, so I do not have the laptop with the camera.
No problem. You can carry on. I'll tell you if it is not there. I'll ask you to stop. Okay, but I think so. Carry on.
So it is just a history of the tobacco, which I think not required much, but as we know that tobacco releases tar gases, nitrosamines, and nitrosa, then hydrocarbons, which all are carcinogenic. Okay. So there have been several studies where clinically healthy mucosa have shown some changes, like higher cell proliferation rate, nuclear cytoplasmic alteration, and the agnose count, which may lead to dysplasia, and ultimately which may result into OSCC, oral squamous cell carcinoma. It was the reason, we tend to use some simple, painless, inexpensive, and non-invasive diagnostic technique, which includes exfoliative cytology, which was earlier used for the which is also used in nowadays also, but earlier it was used mainly for the vaginal smear. So similarly, for oral cytological smears, we have used oral exfoliative cytology procedure, which could increase the chances of earlier detection of pre-malignant and malignant lesions. Okay, so now regarding the PAP stains, we used various parameters such as nucleus diameter, then the shape, discontinuity, texture, cell diameter, and nuclear cytoplasmic ratio. And in this study, nuclear diameter, cell diameter, and nuclear cytoplasmic ratio have been shown to be significant in evaluation of oral lesions. Next. Okay, and while the agnose, that is, these are the loops of DNA which are actively transcribing to ribosomal RNA and ultimately to protein. So the malignant cells presented higher numbers as well as the irregular shaped agnose per nucleus, while in benign cells the regular shape and fewer agnose per nucleus were there. Next. Okay, so early detection, definitely, as we all know that early detection of oral cancer or any type of cancer, any type of carcinoma is really helpful to prevent any further changes. Next. So the objective was that we should do a cytological screening for high-risk patients. And this study was done to evaluate morphometric parameters as well as agnose in oral mucosa of tobacco users and non-users. And then we compared these results with the frank oral squamous cell carcinoma patients, so that we can assess the potential damage of the tissue. Next. So we studied around 50 subjects, in which we included 20 tobacco non-users, 20 tobacco users, but without any lesion, and then 10 tobacco users which who had oral squamous cell carcinoma. Next. Okay, next. So the inclusion criteria was like history of tobacco use, at least 10 smokers per 10 persons who used to smoke 10 cigarettes or BDs per day for 10 years, or Tobacco chewers around 3 to 5 sachets per day for 10 years. Non-alcoholic, free from systemic disease, and patients between 21 to 40 years of both the genders. While the exclusion criteria was alcoholic subjects, then any patient with systemic disease and clinically apparent oral mucosal lesions or previous benign and malignant oral lesions. Next, or the patients who are receiving radiotherapy. So this is how we took the samples. Next, cytobrush, and this was our working solution, solution A and B. Next, and this was the pap staining technique. Next, okay, so pap staining stain smears were used to assess the quantitative morphometric parameters such as cellular diameter, nuclear diameter, and nuclear cytoplasmic ratio. And for this, we used image analyzer software. While okay, and the calibration of the image analyzer was done with 0.01 millimeter calibrated slide. And ignores were counted from the silver slides. Okay, and so to make it more simple and more clear, we opted to study the first 100 cells. Okay, and then the mean value was calculated, and we carefully included the cells which were in the field of vision with clearly defined cellular and nuclear outline. Next. Then the ANOVA, one-way ANOVA was performed to compare the mean of cellular diameter, nuclear diameter, as well as the nuclear cellular diameter ratio. Next. So this was the division between the tobacco users and non-users. Next. So in this, as we can see that non-users have shown more cellular diameter as compared to the tobacco users, as well as the oral squamous cell carcinoma patients. Okay, so this is the nuclear diameter, which is gradually increasing, so which ultimately will result in disturbing the nuclear cellular diameter ratio, which we can see in this graph. Next. Okay, and as well as we can also appreciate the increasing in ignores count. Next. So again, we can compare the ignores count and nucleus diameter, which are increasing in oral squamous cell carcinoma patients. Next. So all of the major forms of tobacco uses can cause oral cancer, whether it is chewable or in the form of smoke, whatever it is. And definitely the magnitude depends upon the amount and duration. And the normal tissue, when it transforms to pre-malignancy or malignancy, cellular changes occur at molecular level before they are seen under microscope, and much before the clinical changes, which become evident at a later stage. Now, this is the point, like this constitute one of the keys. Okay. Here. So one of the keys in reducing the mortality and morbidity, as well as the cost of the treatment, which is associated with the oral squamous cell carcinoma. So there have been several studies in literature where they have used cellular diameter and nucleus diameter for analysis of cells. And they also have reported the reduction in cytoplasmic area while increasing the nucleus diameter, which indicates the early dysplastic changes. So, okay, so this was a previous study, Hande et al. They did it in 2010. Next. Okay, decrease in cell dimension could be due to inability of the cells to mature when they are active in their life cycle. And the amount of cytoplasm which the nucleoplasm makes also diminishes in dysplastic cells. And increase in nucleus diameter could be due to increased DNA, which is essential for proliferation of cells. So therefore, two important parameters to signify dysplastic changes are cellular diameter as well as nucleus diameter. Next. One of the effective methods for measuring proliferation rate is, so this ignores is to measure the proliferation rate, because nodes are the loops of DNA actively transcribing into ribosomal RNA, and which is being further converted into proteins. So ignore count has been described as a good method to determine ploidy, proliferation activity, and even metabolic cell activity. Next. Okay, so there were two studies which showed increased keratinization as well, and the higher agnose count in smokers. So was the result of our study with progressively increasing mean agnose count from non-user to oral squamous cell carcinoma patients. Previous. Okay. So the study shows the importance of early recognition of cellular alterations for identification of individuals who require early intervention, even in the absence of visible changes of mucosal surface. So definitely when mucosal surface, like if you remember, our inclusion criteria was tobacco users, but without any lesions. So the person who does not have any lesions should be like this oral exfoliative. With the help of oral exfoliative cytology results, we can definitely create an awareness among the tobacco users, like okay, so these changes are going on in depth at your cellular level, though you are not having any frank lesion as of now, but definitely if you'll continue with the habits, you may have lesions in your oral cavity. So these are the, like, with the help of these quantitative techniques, we can improve the diagnostic value of oral exfoliative cytology. And so concluded that cytomorphology is an invaluable parameter to assess the influence of tobacco on oral mucosa. And we propose that other studies using this technique on the larger number of patients to be carried out. Next. Thank you.
Thank you, Dr. Kapil. Excellent presentation. I would like to ask you one question. Okay. You said among the that patients has no lesion. Means the submucous